According to the Guttmacher Institute, by age 45, 24% of women will have an abortion. Of these women, 59% will already be parents. From 2008 to now, the demographics of those having an abortion has drastically changed. The number of adolescents having abortion has declined by 32%. Why do we care about these changes in demographics? We care because it shows that women having abortions are facing hard and difficult decisions. They're contemplating starting a family and starting their career, and they're facing the severe financial burden that having a family can have on them. According to the Washington Post and OYA's, a website that summarizes Supreme Court cases, in 1973, there was a Supreme Court case called Roe v. Wade that the Supreme Court passed. Roe v. Wade has been used in many Supreme Court cases regarding sexual behavior, data privacy, consumer rights, and alternative measures to health care. Roe v. Wade basically affirmed the right to privacy. In 1992, the Supreme Court affirmed Roe v. Wade in a Supreme Court case called Planned Parenthood v. Casey. This Supreme Court case stated that lawmakers couldn't place undue burden on women trying to have an abortion. This Supreme Court case was affirmed by Whole Women's Health v. Helderstadt. This Supreme Court case struck down Texas lawmakers trying to impose hospital-like standards on abortion clinics. Why do we care about all of this? We care because countries that prohibit abortions find that abortions still take place. However, these abortions are happening in unsafe and unsterile conditions. Worldwide, it's estimated that 8 to 11% of all maternal deaths are due to botched abortions. Women are going to extreme lengths to avoid pregnancy and to maintain control of their life. Abortion is healthcare, and abortions won't stop because it's delegalized. Delegalizing abortions will only stop safe abortions. I care about all of this because I'm a woman, and I agree with what the statistics show. They show that education and prevention is the best way to decrease unwanted pregnancies, thereby reducing the number of abortions. I'm not here to persuade anyone about the legal or ethical points of having an abortion, rather to point out some of the things that can happen if abortion is criminalized. First of all, according to the Guttmacher Institute, abortion will continue to happen as it does happen in countries where abortion is illegal. 50 countries worldwide have laws that make abortion completely illegal. Worldwide, 36 to 53 million abortions take place each year. The difference is that abortions are happening in places where patients can have safe and sterile abortions, and places where abortion is unsterile and not safe. In Latin America, there are 30 to 60 abortions per every 1,000 women. Interestingly enough, Latin America actually has some of the strictest abortion laws. In Western Europe, there are 14 abortions per every 1,000 women. The difference between Latin America and Western Europe is the place and the way that abortions are taking place. In Western Europe, they can happen in doctor's office and in hospitals, and in Latin America, they're taking place in back alleys. In 2014, it was estimated that there are 22,800 deaths due to botched abortions. These are the lengths that women are going to maintain control of their life. Secondly, abortions, these are not 18-year-olds having abortions. These are women who are facing extreme choices. In 2014, 85% of all abortion patients in the United States were in their ages of 20 and 30. 75% of them were low income, according to the Guttmacher Institute. 49% were below the federal poverty level, and 26% were 100% to 199% of the federal poverty level. Pregnancy and motherhood is extremely financially taxing, and for women who are already extremely financially taxed, in my opinion, it could be placed as undue burden. Thirdly, abortion is healthcare. In the United States, we deem pregnancy as a medical condition. Pregnancy alters a woman's physiology. It places financial, mental, and physical burden on a woman, and most insurances will pay to continue a pregnancy by prenatal care. However, not every insurance company will pay to end a pregnancy. According to Smart Asset, it was deemed that to have a vaginal pregnancy in 2018, it would cost between $5,000 and $7,500. It would cost in 2018 between $7,500 and $14,500 to have a vaginal a cesarean section or a C-section. In the first trimester, it would cost $300 to $400 to have an abortion. There are many medical reasons to end a pregnancy. During the second trimester, physicians can screen for congenital and chromosomal birth defects, such as encephalopathy, which is a brain growth disorder or a lack of brain growth, skeletal aphasia, which is skeletal dysplasia, which is abnormal bone growth, and renal anagenesis, which is kidney failure or the failure of the kidneys to develop. All in all, education and prevention is the best way to decrease the number of unwanted pregnancies, thereby reducing the number of abortions. We cannot control what everyone does. And in parts of the country where abstinence-based sexual education is the norm, it's been found that those parts of the country have the highest rates of unwanted pregnancies. Pregnancy, motherhood are both personal decisions to be made by the individual, not to be made by lawmakers in Washington, D.C. or in state capitals. Women in countries where abortion is illegal have hard decisions to make. They're choosing between starting a family and bringing life into this world and possibly facing criminal charges. If the U.S. were to adopt similar policies, we would see an increase in maternal deaths, and we would see an increase in the number of children entering the foster care system in an already stressed foster care system. People in D.C. are trying to dictate what women are trying to do with their bodies. If you don't agree with abortion, I ask that you advocate for greater access to health care, as that is the best way to truly lower the number of abortions that take place. You may not agree with abortions, however, it is not your decision to make. I'm not here to persuade you about the ethical values of abortion, only to point out some of the things that can happen if abortion is criminalized. Keeping abortions legal is important to decrease the number of unsafe abortions, and it's vital to ensure the health of women. Keep abortions legal, as your decision to not have one is just as important for a woman to make the decision to have one, especially when she's placed in some of these hard and stressful situations. Thank you.